not everyone will be cautious about how they look every day. If it's teenager, they are going for that V shape a lot, a lot.
Like how slim?
Like I don't know how to help them.
iPhone?
So small.
iPhone
Smaller than
50?
iPhone.
I do feel like it's different from treating Thai patients, European patient, and Chinese patient.
What's the difference? If I got the whole face acne, I could get rid of myself of the overload work, or I don't need to social anymore. Hello everyone, welcome to today's special program. Today we are very honored to have Dr. here, and we are going to discuss about beauty clinic and the psychology behind those women who are chasing for maybe a perfect look, or we don't know. There's some reason behind this. Before our interview, please allow us to know yourself and say hi to everyone.
Hi, hello. My name is Porani Chattani, or my nickname, usually Thai people have nickname, and my nickname is Eng. It's French, it means one.
And could you please introduce your expertise?
So I've been in Apex, this is like my 7th year. I've been in the aesthetic industry for, let's say, around 9 years already.
Wow.
And normally I do energy-based device. I do face proportion changing, lifting or that. And recently I just started doing a bit of the anti-aging also.
For those who don't know aesthetic, when they first find you to ask for the skincare treatments, and what's their first question?
That would be a lot of people coming in, they look tired or they feels like suddenly they wake up and then when they see themselves, they feel old. Because not everyone will be cautious about how they look every day.
Like in China, we know that a lot of people, they are looking for very like small V because, we have a very big celebrity like Fan Bingbing. I don't know if you know this.
Yeah, I know her.
They have super small face and super V. And so a lot of people just bring the picture and ask the doctor, hey, I just want to be 100% like her.
When you just mentioned about it, I do feel like it's different from treating Thai patients, European patient, and Chinese patient.
What's the difference?
I mean, okay, European patient, they are more of the natural look. They're not trying to make themselves look like 30 years younger or something like that. It's more like, I'm looking for maybe 5 years or max like 10 years younger. They are very cautious about how they look, and they don't want to make it change like that much. I mean, that's what I learned. Right? Yeah, that's what I learned. For the Thais, it can be a little more than the Westerner, but if it's teenager, they are going for that V shape a lot, a lot. They just have very small face, slim face, but they still want to make it slimmer.
Like how slim?
Like I don't know how to help them. I mean,
It's like this?
Yes, it's just
iPhone?
so small,
iPhone
smaller
50?
than iPhone. Yeah,
Okay.
but for Chinese patients, I just realized that it is true that it doesn't matter what age is. When they come to me, they are always looking for a perfect skin, how fair you can make it. I look, how smooth the face can look. Even with some of my patients actually have smoother skin than mine and still wanted to make it smoother. I was like,
They want a baby skin?
maybe their skin is better than baby. I don't know.
Really?
Like it's just, I have no clue how to help. I mean, you have, to my mind, you have a perfect score already with the skin.
I mean, you are at the top of how good the skin could be. So why would you look for a better skin? I think it's something to do with what's her thoughts behind.
So it brings us to the main topic here. It's very interesting. Like a lot of people, when they're very young, they already have the perfect skin and they still want to look younger, whiter, more beautiful. It kind of relates to social media like Instagram or TikTok. They are bringing these young generations to look at themselves in a different way. When you face the camera, normally your face will become, kind of wider, or if you don't have a perfect shape, maybe it can just adjust a little bit and you don't look like exactly like the same when you look at a mirror. It's totally different when you see yourself in the camera, right? I think that could be the main reason for these young generations to, eagerly change their face and appearance. And what do you think about this?
I totally agree. I mean, even if myself, when I scroll on TikTok, put my nose ridge much higher, my eyes much bigger, and my face is like slim to the point I feel like, oh, I can become a supermodel like that. Like, whoa, who's that girl? If I look at this when I was teenager, maybe I don't have the immune to the idea of how I should be looking like.
Yeah.
And mainly I think it's how do you feel about yourself? If you're not actually satisfied about yourself deeply, it can cause like, oh, maybe I should making this happen to me so I can feel satisfied. And the younger generation, I mean, they are in the age where they're looking for themselves in different varieties of way. They don't know what they like or what they want to do or how to make themselves success. I mean, it's like you are lost in the middle of nowhere. Like, and this is could be the way out. Yeah, that's just how I look at it.
As a doctor, what would you say to this kind of audience?
If I have to go and see somebody, I think the energy has to be matched. That's for me. Like the way the doctor think and the way you think should be parallel to the target or the goal that you want. So if one is very pushy and wants you to do a lot of different things, but you're not really sure about it yet, and you don't feel comfortable doing it, I suggest you should, just find somebody who match your energy. Like that is for real. That I do have a younger patients who came to me, maybe like second or third session. In the end, they're actually consulting me about their life.
And as a therapist, I know that a lot of emotion and all the trauma are stuck in their face and their body. And when these emotions are gradually increasing to some extent, they cannot bear it, they just want to change their body or change their face. And so I'm wondering if there's some cases or any patient that you have met that you think that, okay, maybe this patient has very deep psychological problems or something that could you tell us a little bit?
Okay, so I will not mention the name or not in detail
much, but I do have a lot of teen patients who come in to get some beautification done, and they are in the middle of problems in their relationship. And maybe because they're young and when things are not right, like when they just get engaged or they just get married, the whole world shift into something you don't know or you never think.
They're not conscious, uncertain about it.
Yeah, and then it comes to the point that you feel like you cannot breathe. That's exactly the word she used. I cannot breathe. At home, I cannot breathe. That's what she said. I just really don't know what to say exactly, but I remember that, okay, after I listened and I just say, it doesn't matter what you choose, but I mean, you come first. And one thing I want to tell you and just to remind you that you're actually the one responsible for your own happiness. You taking care of your own happiness. So it doesn't matter what you choose. If you take control of your own happiness, it's gonna be fine.
When I look at her, she's beautiful.
She probably have a bit that I can help, to make the skin a little fresher, more moisturized, get rid of some tiny wrinkles, you can do a bit of firming to the face, nothing big or fancy. After everything she's done, I think we didn't see each other for maybe like 6 months or something. When she come back, she just have her breast augmented surgery done. I think it's not just about the face or something. I think it's more about how she feels like this is not beautiful.
It's just about finding a solution, but this solution is not directly pointing to her relationship. Maybe it's just some way to reduce her anxiety. It could be like someone, if they change the career, sometimes they will do the haircut. You know what I'm saying? True. Like they just want to find something change to make themselves feel like, okay, here I'm, redeeming my energy, and then I feel like, okay, I have the right decision, and now I have the energy to make my life choices.
Towards the end, maybe like a year later, I'm so happy for her that she actually moved out of her husband's house
Oh, really?
with her son, and then like separated. And the last time I saw her, she's happy about herself.
What can make your patients trust you so much that they can talk these deep feelings with you? Normally, when people went to consult their doctor, they just want to ask, okay, here's the face that I want, and how can you help me with that? But they want to, deeply talk about this story to you.
One thing I always do is that I always be myself, like be my authentic self at all times.
I'm not just keep quiet, or I just keep talking about whatever that's been to me this recent. Like, I think maybe because I open up a little bit about me for trauma.
Yeah.
I'm not trying to dig to the trauma or stuff. I'm more like to make them relax while doing the procedures, because some of them can be painful, right?
Yeah.
I just feel like, to do whatever that makes her feels relaxed.
What you're doing is actually feel like a therapist. Relaxation is the key. And sometimes when a doctor, he or she maybe just want to focus on the skin problems, maybe they will be very, directly just to the pain points, and they will skip the reason or the backgrounds that bring this person to you. And what you're doing is just like a therapist, to make people relax first, and then they can talk about something deep inside.
What actually drives me to enjoy the career path the most is when my patient actually came back saying that I enjoy the process you did. I love the results and da da da. I mean, one of the things is the results from the machine or whatever, right? But a lot of times I would say when you do the machine with different doctors, there is so many maybe, I don't know, 10, 15, 20% max.
Wow.
But how you feel during the sessions actually affect like the thoughts you have afterwards. And I think that's how the results in her mind.
What you're
change.
saying is really inspiring.
Right.
And
That's how I feel, because a lot of times I feel like my patients love me dearly. I do get a lot of snacks when they travel or they go somewhere, like all the time. Like I mean, it doesn't matter what it is, but when they go somewhere, they think about me.
Yeah.
I feel loved.
Yeah.
And that's what makes I enjoy my
because you have the open heart and you kind of using the therapy technique without notice. Yeah. And then all the way brings you to make your client trust you more, and then it totally change the experience of their going to a beauty clinic and do their skincare treatment or surgery, whatever. So what I want to say, why I think what you say is really inspiring is because, okay, so I'm the person that seldom go to beauty clinic. And when I think about beauty clinic, I think about machine. People are gradually forgetting that it is actually the people, the doctor who are doing the treatment for you. Could you tell us more about the difference, like let's say A and B doctor, if they face the same patient, and what's the differences could be?
For me, the question I usually ask is that how is you concerned about your face? If you have to pinpoint anything, maybe 3 point that you don't like, what is it? Or the point that you like about it, what is it? Something like that. A lot of people will say, hey, what would you suggest? I don't know, what would you suggest? That could be the thing for a lot of people. To me, I feel like as a doctor, I'm responsible to make them feel or look the way they want. Not how I want. Otherwise, everybody's gonna look in the same pattern, and I'll do exactly the same with everyone, and that's weird. I'm not manufactured a beautiful woman. So yeah, so from the start I think we have a bit of argument, like why don't this doctor like suggest me? I believe some would not like the way I consult, because I'm not telling them exactly right away what they should be doing. And I mean, I'm not able to match with everyone, and I accept it. I mean, it's true. Like some people just want to go, okay, you do this is it. then because I would ask and they would not think what they want and just
Right.
keep on this conversation nonstop.
It's not like the designer or architecture when I look at your face and I will, use
Yeah.
my, I don't know.
Designer architecture would try to build different way the building look,
Yeah, of
they will
course.
make themselves or their work unique. I think that's you're a person, so maybe you have twins, but you have different wants with your face.
If a girl, she really doesn't know what she can,
Right.
do with her face. She just watch some like maybe user reviews on
right.
Epic, and
A
then
lot.
they want that before and after effect.
right, a
And
lot.
what would you say?
Well, I mean, I would start with questions. When I ask question, they start thinking about the question. That's when I start. I mean, even if I said, I'm not going to say it right away, but there are some simple things that it's going to be the same for everyone. For example, nobody like a saggy face.
Is there any clients or patient that you met and you feel like, okay, I regret what I say to them?
Wow.
Or you want to say that again? Is there any
Yeah.
story in your mind?
Yeah, I mean,
Yeah, like actually it's something I didn't do well enough. I think I've mentioned it. There are a couple of patients who I've been taking care of, and we've been through quite a few sessions in the beautification journey, and I feel like they have enough, or in my mind I think this is naturally beautiful.
Yeah.
And there's one time when they came to me asking for more injections to make them look a bit better. But I think to make you look to that point, it's going to also lose the natural look
Shade.
of your face, right? So I don't want to make somebody look supernatural,
Yeah.
It doesn't look good, or it's too made.
Yeah.
A few they believe what I said, and I mean, you can make another appointment maybe 3 months or in 6 months, and then we talk about this again later, what I can help you with. But then there are also some people think that, okay, when this doctor cannot do this for me, I'll change with another doctor somewhere else, and then maybe 3-4 months later when they come back, they want me to fix it. Like it's too much. A lot of people said they look like a comic. Well, that's Thai, the comic look.
What is comic look?
It's like it's not real. Let's say that it's
Not real.
like you come from a comic. You have that
yeah, I understand.
round looking kind of face. It's cute, but it's not real.
Yeah.
I think what I regretted the most is that I did not. I don't know. Like I feel like I'm responsible to be able to talk to them and let them understand me fully. That's why I'm not doing this for them. Not because I don't want to, but because you should not be doing that. And I mean, it's a bit of a challenge because sometimes they would listen to you,
Yeah.
sometimes they would not. Sometimes that they listen, but in their minds, they're not actually agreeing with you, and they're
Yeah.
not talking what their thoughts out.
Yeah.
And I think that's a bit of a challenge that I did not realize that she did not agree with me during that session. So yeah, I think that's something I regret. I try to make my consultation that my patient understands to the point where there's no doubts
Yeah.
why I'm not doing too much.
But you've already tried your best, I
Yeah.
believe, because a lot of patients or clients, what they are searching for is like the solution that they think that are perfect for them at that moment.
Yeah.
And I think it's a natural process that they have to experience something with so-called failure or obstacles so that they can understand what's a natural look will be like.
Yeah.
What's the difference between 100 and 101?
Yeah, true.
That is totally different.
True.
Yeah,
So
but
true.
they've got to believe the process, and I believe it's kind of like a concept that so many people are obsessed with. That is what is perfect.
Yeah, true.
I mean, what is perfect? Like you said, that maybe 99 is already perfect, but they want 100.
Yeah, true.
But when they reach 100,
They don't
the
like
score,
it.
they don't like it. Not just they don't like it, the score become not 99 anymore.
Yeah.
It becomes 60
Yeah.
or even worse.
Yeah, true.
So what do you think about a perfect look and a natural look? Or do we have one more word to describe like their standard of beauty?
Right.
Like Asians people, the way beauty standard of us is one way.
Yeah.
When I'm talking about like when I'm talking with a European or Caucasian patients, the beauty they're talking about is totally different. For example, very simple example is the hollow cheeks.
What?
Okay,
Which
for
ones?
Asians, the cheeks here should be round, kind of like, you know, you have to make it like in the same way. But if I have a Caucasian patient, I cannot. I must make the cheekbone a little more up, on the jawline up, and then here hollow. That's how they feel that this is the beauty standard of them. So I think beauty standard is also not just about how you look, but how other people around you think this is good. So it depends on what the society that that person is in. If you look at your friends, for example, if all of your friends have that, you know, more than normal look, eventually you feel like that is normal.
Yeah.
And that's how you go for that treatment or whatever specific treatment it is. But right now, you don't have to be surrounded with real people. You can be surrounded in Instagram with those look in the Instagram, and you feel like, oh, this is normal beauty standard for me look like. So I think it's very difficult to say exactly how it looks. But there is one funny joke that a lot of doctors would do is that you look at the doctor's face, that is something she think natural is. If you see and you feel like, okay, that's natural for me, okay, that doctor should see the beauty in the same way you see. If one you see, oh, this is a little too much, it's not that he or she wants to do it too much. That's the beauty look in their eyes. So
True. That is true. So true. For those who haven't been to beauty clinic, this is a very good advice. Just look at the face or the energy field that the doctor given to you. This comes to the question: how can people fully understand what the doctor is trying to tell them? Like, because if they've already trusted some concept or
it's
idea
easier.
that maybe from, I don't know, maybe from the social media, maybe a fake doctor had told her that this is the right choice. And what would you give this kind of advice to for those who don't know who to trust?
So, I mean, I think the easiest way you can do is that listen. Just mindfully listen. The whole sentence, the whole word, the gesture of the body, you know, be present to hear, not in your mind. When I'm talking, don't think about what you want to respond to me. One thing I've learned is that I don't know how much of the false advice they've got from the clinic, because they seems to not care like how I talk about.
Oh, really?
Yeah, because they feel they don't trust me sometimes. I have one Chinese patient who would wanted to do a program harmonica injection in one side of the face and program fillers to do another side of the face, which is weird for me. And it's her first time doing injection, and I was like, hey, this is honestly, this is not something you should be doing. You should be doing, you know, the same thing, or you cannot expect this kind of results. And she said because her face, the two sides of the face doesn't look the same, and she already studied about it, and this is what she wants. In the end of the day, okay, I did it, and then she said she was happy that it looks more even. But I also suggest, because in the 3 months time your face is going to change, because harmonica, you want to stimulate the production of collagen, you want it to lift more in the next 3 months. Fillers is going to stay the same after 3 months.
Her face become more uneven.
I don't know, but she doesn't come back yet. It's been just maybe a month or two. We'll see.
Yeah, we'll
But
see.
sometimes it's very hard if the thought is that I try to sell them something, you know. In fact, it's going to be the same price if you do inject the same thing. I don't know why, but yeah.
Okay, let's have a quick break because we've already talked about a lot about the psychology and the relationship between psychology and the beauty clinic. And next episode, we are going to dive deeper about the topic that as a beginner who are going to the beauty clinic, what's the best solution for you? See you next time.
Bye.
Bye.